Hello and welcome to the DentisTV episode filmed at the Dentistry Show 2012. We're here at the NEC in Birmingham and I'm going to be interviewing speakers, exhibitors and delegates. I hope you enjoy the show. Richard, you've just done a presentation at the Dentistry Show. Do you want to tell me a bit about what you spoke about?
Okay, well my topic is inhalation sedation, sometimes called RA, which is relative analgesia, and had a great opportunity today to speak to the Hygienists and Therapists Symposium because 5 years ago the GDC changed the scope of practice to allow that group of DCPs to operate as sedationists too using RA. But there's an issue, or there has been an issue with training, so it's a question today really focusing on what would it take for them to become trained and competent to provide that service.
And do you find that this group of DCPs are excited about the prospect of being able to deliver this kind of patient care?
Well, they certainly are. I guess it depends. You see, if they're working in a practice where they're already using the technique, one hygienist came up to me immediately afterwards and said she's very keen because her boss wants her to be able to do this for their anxious patients. If they're working in community, the same kind of applies. So there's definitely a place for it.
And in terms of your presentation, were there any interesting questions and interactions that came about from the audience?
Well, there was a great deal of interest in the live video I showed of patients having the treatment. We showed one case of a 12-year-old, I think it was, having 4 teeth extracted under sedation. You know, within 2 minutes she's perfectly recovered, smiling, having just had 4 teeth out. And she's going to grow up without a fear which has been brought about by perhaps having a general anaesthetic, so by avoiding a general anaesthetic. So it's a great service to the patients. One question that came up at the end was, is it okay to use this technique for asthmatics?
Oh yes.
My answer really was, if you have somebody who is having an acute asthma attack or really wheezing and having difficulty breathing, you certainly wouldn't use it. But for somebody who's on your medical chart as asthmatic and they carry a puffer, but normally they're okay, it's a very good technique because it relaxes the patient. It means that the bronchial tree is relaxed. They have a higher oxygen intake from the gas and air mix that we're using than they would breathe in room air. So actually it's more beneficial, and the relief of their anxiety means that they're less likely to have an asthma attack.
Sure. And what do you enjoy most about coming to shows like this and presenting to audiences?
Well, this is the first time I've ever presented to an audience of this size. So it was a big thrill for me. Came about through a Twitter and Facebook contact with Mari Coxon actually. So that was interesting how social media can work in that way. I normally present to much smaller seminar type groups, 8 to 15 people. So it was a big stage for me today, but I enjoyed it.
Ken, you're part of the speaking program here at the Dentistry Show. What are you speaking about later today?
Well, it's a controversial subject. I'm talking about ovate pontic creation, which is, I suppose it bears a little bit of explanation. If you're a dentist, you'll know what it is. If there's a missing tooth, we have 4 ways of dealing with that. And the overriding popular way of doing that right now is with implants. And they're wonderful, but sometimes they don't look good, and that's a bit controversial. I understand that, and we have to sometimes resurrect the old ways. I'm not talking about dentures, I'm talking about fixed bridges where we, hesitate to say it, file down some of the supporting teeth either side. So I think you still have to have these old-fashioned skills in your locker. Okay,
and what do you expect to hear from the audience about this controversial subject? What do you think they're going to say?
I expect they will say, that's a very old-fashioned way to work. However, I do bridges probably 20% of the time when I have a missing tooth situation. It is overwhelmingly implants, but sometimes, for reasons of their own, patients decide they don't want an implant. It might be fear, it might be cost. We don't know what it is, and I think it's incumbent upon us as caring practitioners to be able to offer another alternative. I do think it's important that we don't give everybody an implant.
Okay, fine. And you're also a practicing dentist every
Yes.
day, so you apply these principles to your own
Absolutely.
practice and to your patients.
My presentation today will have a lot of photographs of real life people, what I work on a day-to-day basis. I have a nurse who's pretty well a full-time photographer. We take perhaps 200 photographs a day. We're into terabytes of storage, so I've got absolutely loads of examples of this in real life. I've got photographs of implants too, which I'll be showing, the good, the bad, and the ugly, and also the good and the bad and ugly of bridges, but you can show bad examples of implants, bad examples of bridges as well. What I'm trying to do is show good examples of bridge work to go alongside the good examples of implants. I just don't want the skill to die.
Yeah. In terms of dental conferences and speaker programs, how important is it to show the good and the bad?
Oh, I think there's too many presentations, and I think all of our colleagues will tell you this, where all you ever see is the best. And we all have a skeleton in the closet. We all have the one crown, the one filling that for whatever reason, it drives you to distraction. It just seems to have a death wish. So we keep them quiet. We only show our Sunday best. I don't believe that's true. I think we all have to show that there are failures. And failures can be cosmetic. There can be a mechanical failure where the damn thing breaks. Sometimes there's a psychological failure. You don't get on well with the patient one way, or they don't like the result. Equally as well, I suppose the fourth failure is when a colleague disagrees with you, and that's just what I'm expecting this afternoon.
Fliss, do you want to tell me why you decided to come to the Dentistry Show?
Just looked at the programme and obviously saw the speakers that were coming today and just thought it would be great. Listened to Tracy Stewart this morning, fantastic, sort of hearing about patient care coordination and just sort of other people, just getting to meet sort of people, networking and seeing what new sort of products are available in the market.
Yeah. Do you want to tell me about your role in the practice where you work and how useful you find it coming to the exhibition area?
Of course. I'm a practice manager, so obviously it's great to sort of be able to come along and meet sort of other practice managers, just sort of interact with people, just hear about what's going on within the industry, and sort of take away tips and things that I can obviously put into practice and use when I go back. So yeah, it's good.
Okay, fantastic. And other than Tracy's program talk, what other presentations did you go to that you found inspiring or interesting?
I'm also going to later on this afternoon the dental nurse bootcamp talk, just obviously sort of hearing about integration as I'm currently recruiting for new staff, so really looking forward to sort of listening to that. Just here for the one day, so I'll just sort of going around and see what I think.
Yeah, so a boost of information and inspiration and taking ideas back with you.
Yeah, sort of fire up to go back and then sort of pass on to the team and sort of start integrating things into the practice.
Brilliant. Les, thank you very much for your time.
Thank you.
Steve, thank you for your time. You've just been lecturing this morning here at the Dentistry Show.
Yes, I have.
Can you tell me a bit about what you spoke about?
Well, my program today was called Realizing the Dream.
Okay.
Achieving Your Fullest Potential.
Okay. And what was that about?
Well, I've given this program for 14 years in various different ways. And it's about the fact that I'm a full-time practicing dentist. To this day, I'm working this Monday, 2 days from now. And I know what it's like to face obstacles. So, we go to courses like this, we get all pumped up and excited. We hear very exciting, enthusiastic, and informative speakers. And then we go back on Monday, and it's really hard to put it together to make that happen, what you just heard. So I break it down into what I think you really need to do to achieve high levels of extraordinary success. And I talk about everything from the very beginning about walking your talk through clinical excellence. I mean, you can't go out and buy a machine, with all due respect to the great manufacturers that we have in today's dentistry. That a machine doesn't solve your problems. What starts to make you get out of the horizontal non-growth place is becoming clinically excellent. Because really, it's not just that you become clinically excellent, it's that a patient can feel that. So if my listeners would think back to probably the best week they ever had in practice, I would almost guarantee you they'd have followed a new course they just took. Because they come into the office on Monday, and guess what? The patients that they're sitting next to, the new ones especially, feel that.
Yeah.
Okay? It's not about how fancy your waiting room is. So I show my waiting room, which is not fancy. Okay?
Okay.
I talk about, and my practice is, and I say this with humility, extraordinarily successful by anybody's standards. I mean, I practice in a town in New Jersey that was ranked for 31 years. I'm still there. The second worst place to live in the United States. Okay? Wasn't the first, but it was the second.
Okay.
And I've been in the same town, yet I've been able to achieve a practice that does the equivalent of 2.5 million pounds in UK on a 4-day work week, a part-time associate, comprehensive dentistry that most dentists I think would be proud of.
Yeah.
Happy patients, the same staff for 20 years. The average person's been with me for 16 years.
Okay.
And by the way, I don't want this to come off of at all on camera like I'm full of myself
No.
and that I think I'm great. I mean, here's the truth. I graduated in the bottom of my class, not the top. I was so bad that I didn't even get to go to a residency. I went back to my town because my dad was a dentist. And I went to that town I just told you about. And so over 30 years, I nurtured and developed, and I just did it what I thought was natural. This incredible practice that commanded high fees, it's fee for service. And listen, I know here in the UK that many dentists trapped in NHS. And listen, if I was here, I can tell you I wouldn't do that, or I wouldn't be a dentist. And no offense to NHS people that may be watching, it's not an indictment of you. It's, listen, I have a profession, you are part of my profession, and there's no way I'm going to walk down your avenue to practice what I do, because I'll be burned out, I'll be frustrated.
Yeah.
It's not about, for me, about getting wealthy or how much money I can deposit, because a lot of the people in my audience would be quick to tell you that the end of my presentation was all about the requirement to give back if you really want extraordinary success.
Okay. Thank you for watching Dentist TV, which has been filmed by the crew of JSP Media Group. For more episodes of Dentist TV, have a look on our YouTube channel.